Thank you for keeping it Citizen Television this particular morning. And of course, we just want to talk about something very pivotal that is coming up, I believe in 2 days, on the 29th of September 2023. So each and every year, the whole world actually just joins, collaborates to mark the World Heart Day. And around this time, this is when we get to really focus on creating awareness around heart diseases, what needs to be done, what, where we are in terms of the numbers, and of course, what we need to do in terms of preventing heart diseases. Just the basics. And in case you find yourself in a situation where you could be suffering from any form of heart disease, what's the way forward? Is it treatable? And what are some of the expectations that you should have as a patient when you go for this treatment? So that all those questions you have will be answered in studio this morning. We have Dr. Charles Kariuki. Dr. Charles Kariuki is a cardiologist based at the Nairobi Hospital, right here in Kenya's capital. Thank you for creating time for us.
You're welcome. Thank you for having me.
All right, so we want to start from what's happening on Friday, just a general perspective. We are marking the World Heart Day this coming Friday. From your perspective, probably, what is the significance of this day?
Well, the World Heart Day is an initiative of what we call the World Health or the World Heart Federation. Mm-hmm. And I think the head of the World Heart Federation in 2000, about that time, I think it was, felt that we need to mark one day in the calendar to, dedicate to heart diseases, educating people on heart diseases, and promoting an awareness of heart health, mm-hmm. so to speak. And I think since then it's been an annual event and across the world. And we health promoters are meant to educate, create awareness with heart diseases, mm-hmm. and point people towards healthier lifestyles and other root causes of heart diseases, mm-hmm. and promote also health-seeking behavior with regard to heart diseases. And that's where it came about. So it's marked by, events, different types across the world. It's not a lot of fanfare, but like in Kenya, I think sometimes we involve the athletes to talk to the communities. There will be walks and so on and so forth. Mm-hmm. Yeah.
And when you see those walks, by the way, they are not in vain. They are there to promote what we call physical activity and exercise, which, as we will be having this conversation, is a very, very important way of, preventing heart diseases. But, every year there is a specific theme that comes to it, and I just want to get your mind a little bit on what this year's theme means to you. Use heart, no heart. From where you sit, how do you interpret this?
Well, it's always difficult to read the minds of the people who came up with the term. I was trying to understand what exactly, but the general push is use heart, meaning that put in effort, clean effort, a lot of effort to try and get people to know about the heart. And I think the theme, the words change every year, but it's generally the same thing, the same push, and trying to target or reawaken people's minds as to, I might have a heart issue maybe, or I am prone to getting a heart issue. Let me see what I can do to prevent it. Let me tell the next person of how to prevent themselves getting heart diseases, mm-hmm. your friend, family, etc. So just creating an awareness about day-to-day life issues that promote health, heart health, or that can predispose you to heart diseases. So using heart means using energy, form, and so on. Mm-hmm. Yeah.
Yeah. Usually this ordinarily should happen all year round.
Absolutely.
But we just sort of escalate this conversation around the World Heart Day. But it's something that the knowledge and awareness is something that we should be doing all year round, because heart diseases are not a joke. I've just run you through some numbers from the World Health Organization, which shows us that 1 in 3 cardiovascular disease deaths occur prematurely in people under the ages of 70. So if you thought that it was a disease for those who are advanced in age, then you could be wrong on that. And then it also goes ahead to say that more people die from cardiovascular disease worldwide than from any other cause. This is about 17.9 million people who die every year because of heart disease, and 4 out of every 5 cardiovascular deaths, that's roughly about 80 or 85% thereabout, are due to heart attack and a stroke. And this is where you come in, Daktari. Is it that serious? If you can even bring us home and tell us, you know, these are just global numbers. You can even just paint a picture for us how we look like in the country.
Well, there have been disparities in terms of manifestation of heart diseases over time. Maybe 30 years ago, this statement would have been one that, or even 40 years ago, most people would not have related to that in Kenya, because I think our grandparents and their forefathers and so on were more physically active. If you ask them, they'll say, you know, my colleagues who are ahead of us, some of them tell me they only saw one heart attack in their whole training period in medicine. It was rare. Today, it's every day. If you go across the health institutions and ask how many people have come with a stroke or a heart attack, it's every day, several times a day. So there clearly has been an increase. And I think what I'm trying to bring up is that stepwise progression of what we call demographic change, meaning the kind of the age groups, the lifestyles, and the exposure to certain things that promote heart diseases that we Kenyans now are exposed to. And so we are catching up fast with these numbers that you're seeing. And indeed, most of the heart disease now is in the developing world and underdeveloped world, so to speak, the burden of heart diseases. And that's promoted now by, you know, many factors that you can mention, including diet, physical inactivity being, I think, probably the most common denominator, and mental health even. So there are factors now that have pushed us right up there where those numbers are. And so yes, it is that serious, to answer you.
Okay,
yes.
So it is that serious, and we need to talk about this. And I just want us to now understand this problem that we are discussing, because it's all about creating awareness this morning. When we talk about cardiovascular diseases or heart diseases, what exactly are we talking about in basic? You know,
that's a good question. I mean, you know, we can trumpet about heart disease, but what is it actually?
Exactly.
I mean, I just think of the typical person waking up and going to work. They don't think about, is my heart okay, as they drive in traffic. They're busy thinking about how they're going to make, I don't know, the best next deal or whatever it is people do. So the heart is an important organ. It's a critical organ in your body. So it starts there. If the heart does not do its function as you expect it to, there will be manifestations. And these manifestations may include early death, if we go to that extreme. But in between that and maybe when you start having heart problems, the heart may pump inadequately. The heart may be pumping against blood vessels that are tight, creating high blood pressure. So your pressure within your system, if you think of the waterworks in a house, if the water is in excess pressure, a pipe is going to burst. That's your stroke. Or it'll block because you're pushing things into junctions or joints in water piping, and that will create a heart attack or stroke. So there will be something going wrong if your heart is not functioning optimally. And that creates part of the heart disease structure, or the fundamentals of the heart disease, where you have a malfunction of the heart and blood vessels. Now, you may go for years with heart disease undetected. That means you have high blood pressure, for example, or you have a weak heart giving you heart failure, or you've got effects of these problems of hypertension, heart failure, such as kidney malfunction. And even your brain can malfunction. You'll be getting mini strokes and you don't know. Or the blood vessels to your legs are blocking off slowly. So the heart disease encompasses that. And actually you can't dissociate heart disease from blood vessel disease. So we call it heart and blood vessel disease. So when we talk about cardiovascular disease, cardio, heart, vascular, blood vessels, because the heart does its work by taking blood through the blood vessel. So heart disease is malfunction of the organs that pertain to circulation, the heart and blood vessels. That's what it is.
Do you think it's a big problem, you know, what you just mentioned, people walking around with these conditions undiagnosed?
Well, I could just pick one. For example, half of the people who have high blood pressure don't know they have high blood pressure. It's as bad as that. You might ask me then, so what? Is that a big issue? And I'll tell you, yes. In, say, Nairobi, if you take people between the ages of 50 and 70, half of them have high blood pressure. Half. Walk in anywhere and take those numbers and check. So that's a big problem. And how many of those will then go on to manifest conditions, quite a number. And we have statistics, not as good statistics as I'd wish locally, because we don't record everything that happens in the small health centers and so on and so forth. But we do get the impression that the numbers are really something. We get a lot of patients coming to us, leg swelling, can't breathe, or straight up heart attacks. The over 70 that you're mentioning, we are now, just this last couple of weeks, I've had people 39, 35, 40 heart attacks. So yes, it is a problem.
Yeah, so it's coming closer to you actually.
Yes,
something you shouldn't ignore. Do they manifest in types? Do we have types of heart?
Yeah, we have several classifications or we say definitions of heart conditions. And it may be, I'll pick a couple. Okay, you can have common. Those that the most common, I think, being hypertension. Whenever you look at any registry and check of these people who came to us, maybe dead from a heart condition, what was the commonest underlying condition they had? It turns out it's hypertension in most registries, running at about 70%, 65 to 80% of people will have high blood pressure. It's common enough in its own right, so that there may be some overlap with that. Then you will have diabetes promotes heart diseases, and about a quarter of people coming to us with heart attacks will have diabetes, and that's true across the world. Slightly more, slightly less. You'll find out that some people maybe have high cholesterol. And I must say the high cholesterol issue is beginning to concern me, because we have generally high cholesterol levels in the cities across Kenya. Mostly we know that because those are the people that get checked by insurance more than, say, rural communities. So high cholesterol is a big issue. Diabetes is becoming more common, and as people sort of live in cities longer, don't exercise because they're driving to work, or they don't do jobs that would promote exercise, they will develop problems such as diabetes. So I would say that hypertension would be very common. Diabetes becomes a promoter. Smoking is important, although maybe the rates of smoking in Kenya, I'm not too sure we know the numbers. There has been a decline in smoking rates in certain parts of the world. And then overweight states. And I think physical inactivity, mental stress being an important one. Alcohol overuse is an important one that causes the heart to weaken, and so on. So I'm just giving you a glimpse of some of the common situations in which heart disease comes. But then if you ask me, a regular person going to work every morning, and what will ail them? I think physical inactivity and high blood pressure is where it starts. High cholesterol, diabetes, that's where it starts. Add stress onto that, it adds something. And that's your classic Kenyan Nairobi urban dweller. If you go to the other counties, you're beginning to see that kind of thing in the developing towns. In the rural areas, it's also quite something now because of exposure to salt and exposure to inactivity. You'll find a lot of them are employing people to do their manual work. So you find that the obesity rates, inactivity rates in the rural communities are also becoming an issue. Border borders all over the place. So pay a little money and you get taken to the next health center. To the next center.
You prefer a lift as opposed to taking the stairs? You prefer ordering just something at the comfort of your home as opposed to going to the supermarket to pick it yourself? I mean, life, the more we try to make it easier, the more inactive.
And then just think about what you're ordering, by the way. What do most people order online?
Fast food.
Yeah. There you go.
All right, and that's where I want us to go, because most of these risk factors you've mentioned really have a nexus with how we live and our lifestyle on a day-to-day basis. What concerns you about the populace in terms of how we live that would say is actually something that would justify the surge in the cases of heart disease?
I think physical inactivity for me is number one. Yes. When I look at the life structure of most people that I come across, there are those who go to the gym, which is fine. How many can afford a gym? Not that many. And getting to work, walking can be even dangerous, at night or early morning when people go to work. So they'll ride on matatus and buses and drive to work and so on. And when they get to work, the area does not promote, the work environment does not promote exercise in many places. We could start here, but anyway, that's for another day.
Don't go there.
So I think physical inactivity comes first. Then there is the dietary issues. Most people will have salt in their diet more than they should. I'm not saying that you shouldn't have some. And again, how much are we eating in terms of vegetable and so on? There's a lot of high energy, high carbohydrate intake. And that's, for me, the next thing that we need to really watch watch out. If you go to, I was just watching the other day, I was parked at a gate and that was about to be opened early in the morning. And the security staff had bread brought to them in a big carton. The guy's leaving and the guy's coming on. It was a nice gesture by the owners of the company, but that's bread that you're giving them. The ingredients are basically what you know, trans fats, wheat, and salt.
Are you saying bread is not recommended?
Well, I didn't say anything, I just said what's in it.
You're scaring us.
So that's what those guys eat every morning, and they're happy because they've been given that. So even our mindsets and the knowledge of what we should be doing is not right. And if you start trying to promote good health, where is this food going to come from? You might tell people, fine, let's get arrowroots and sweet potatoes. What's the cost? Where do you get them? How many communities have access to healthy foods? So I think the diet is a big issue. Okay, how much of that needs to be teased out with regard to what people are actually consuming on the table, depending on where your environment is. If you go to maybe next door to Kibera and try and look at what people are consuming, it may actually end up being healthier than what the upmarket places are consuming. And then again, it may not be healthy, because when you look at the edible oils that are being used in this country, you have to scrutinize them and ask yourselves, what are we promoting here? So there's a lot to say. We are trapped in a lot of things when it comes to physical inactivity and diet. And then you add on to that the drive everybody's pushing to get things done. It may not even be the stress that comes from being under duress. It may just be the stress of daily life. In traffic, I've got young guys who come to me with high blood pressure, and I tell them to slow down, just get off that traffic pathway, wake up early, or whatever it is. See, the pressure's coming down when they're not pushing to get to work or pushing to get things done during the day, and so on and so forth. Anger is going up, from whatever reason. That doesn't promote good hormones.
How can you avoid stress and anger under these circumstances?
Yeah, it's very difficult. You can try and reduce it, but avoiding it altogether.
Happens,
And stress is everywhere. I mean, our ancestors were facing lions in the forest. I mean, there's always good stress that promotes, certain behaviors, but there's negative stress.
All right. So as we talk about whether this is preventable or not, do we have control? Because what you've described as some of the risk factors and the triggers and the causes actually center around how our everyday life looks like. Do we have a choice? And if we do, what do we do then to prevent, heart disease?
There are very many avenues. It's just a question really of trying to make them practical. And, I could tell you to start exercising and so on and so forth, but I could also go and just look at legislation. When you're designing roads, are they designing walkways that allow and promote walking, so that some people will say, look, it's safe to walk, why don't I just walk? Cycling, it's safe to cycle, why don't I cycle? As you know, in Scandinavian countries, cycling to work is normal.
We sort of attempted that in Nairobi. I don't know how far we are with that, but it was
a good effort. And certainly these are the kind of things, street lighting so that people can walk a bit more in the evening and so on, security. And so I'm just talking about one aspect, okay? When you're putting up a block of flats to mint as much money as you want to mint, have you provided for play areas? Have you provided for exercise areas? Or you've just taken every inch of your space? Forget even the high rises, just go to your own 1/8 najaza nyumba. Yes, have you left any space for recreation and exercise, even for mental well-being? Exposing yourself to the sun, for example, vitamin D, have you done that? So legislation could help by trying to create certain structures that people will follow guidelines, okay? When it comes to a personal level, when you go to the supermarket or to the market, what are you buying? Are you looking to think through what I'm buying, what I'm going to cook, or how I'm going to cook? Or is it easier to just go and fry something and eat that? In households, who's doing the shopping? Who's doing the cooking? Who's directing the making of the meals? If you're newly married, and if you're not fat enough within a few months, there's a problem from the in-laws,
Actually,
not feeding.
It's a good thing if you increase a few inches after.
Absolutely. So I think our mindsets are also an issue. So it's a long conversation, but I'm just trying to give you a glimpse of where you could start.
All right. So, if you look at the people that actually at the end of the day get that diagnosis that they have a heart disease or a heart condition, at what stage? Because, for example, when you're talking about cancer, the concern is majority of the patients actually get their diagnosis when it's already too late. Let's now translate that to heart disease. How does it look like?
Well, I think, again, it's multifaceted. You could tell patients, go and get checked every year or get checked, but what do we really mean? I think, I thought I saw my colleagues, Dr. Nyikal, talking about blood pressure measurement. As simple as that. Just taking your blood pressure and getting it checked every year, 2, 3, 4 times, and then getting the right advice about it, not being told it's a bit high, don't worry, go and exercise. That's one very simple thing you could do. And I think most pharmacies now have blood pressure kits that you can go and I think free of charge, get checked. So monitoring your blood pressure is one. Monitoring your blood sugar is another. It's a simple stick that you can get checked with. So you don't have to go and spend a fortune just to take out those 2 that are easily checked and very impactful in terms of finding out early that, yes, I'm prone to high blood pressure, let me go get treated. I'm prone to high blood sugar, let me change my ways in terms of diet and exercise. So those 2 are low-hanging fruits you could start with. With other conditions, which are a bit more esoteric, if I push you towards, say, conditions of the heart now that come, maybe even genetically, or predisposing you because maybe you were exposed to certain chemicals at work and so on and so forth. So your heart becomes weak. How do I know? That's when now we start saying, if you feel that you're short of breath or you're getting chest pain when you walk or your legs start swelling, those are reasons to start seeking help. Or I've got constant headaches, is my blood pressure high? So when we say when symptoms start coming on, I think it's already a bit late, by the way, but it's not too late. Okay, get these people on the fast track to proper treatment. And you don't necessarily need to see a cardiologist. All you need are good medical facilities where you've got concerned clinicians who will check basic things like the blood pressure, the blood sugar. It's not difficult to check your blood cholesterol, not difficult to check kidney function. And based on those, use whatever guidelines we have given them to treat. If your blood pressure is up, there are booklets at health centers that tell you initiate this drug or that drug and ask the patient to monitor their blood pressure regularly. If we just did that, the stroke rates, heart failure rates in this country would definitely come down. If we tell people, when you're going into your diet planning, shopping planning, and that I think we've done poorly as a nation so far, and I blame ourselves as much as anyone else, giving some guidance in terms of what foods that would be perhaps more nutritious than others and how you prepare them and where you get them, that's something that should be done. And I've been trying to push our nutrition teams to consider engaging the public on that. And whether or not the public is receptive is another issue. If you look at the queues at, okay, let me not name them, some of these fast food joints, they're incredible. And so you also have to appeal to the mindsets.
There's this, people think, I've heard about it, that the healthier foods are more expensive compared to this processed and fast foods. Is it just a perception, or what do you think?
Yes and no.
Like if you're to have lunch in Nairobi,
yes,
if you're to go for the healthier option, it would cost you a few extra shillings compared to just taking some chips and something that you can just very fast. It's quick, fast, and then it's also cheaper. Is it true?
Yeah, I can't claim to be an expert, but I think it's both ways. If you want to have butter cooked or olive oil cooked food, go to this nice Italian restaurant, you're going to pay. But you could also go somewhere downtown where they have boiled your maize and beans and added your sukuma wiki, and you'll eat that.
And it's healthy.
That's way healthier than, say, that chicken that you had fried in oil in town. Okay, so that's why I'm saying it's both ways. But again, the way that the food is prepared in terms of health, cleanliness, and the sterility or whatever is being used, those are question marks everywhere. So I think it's a mixed bag. And if I just pick maybe 2 or 3 items, if you go and try and buy arrowroots or sweet potatoes or millet and sorghum and so on in the shops right now, you will spend money in Nairobi. But those foods are easily available in the counties, in the farmlands. You can actually grow them easily, okay? And when you look at the food production in this country, compare that with food production in some of the more developed agricultural countries. Take Israel, which has got smaller land mass, much smaller than us, producing much more food. I think this is where I'm trying to hint that legislation might have something to do with improving quality of the food.
Yeah.
Yes, by enabling farmers to grow certain types of food and maybe developing their markets. So I think it's a market source issue that needs to be looked at.
So at the end of the day, what you're saying, we are not that helpless.
Not at all.
Yeah.
Not at all.
We actually have a choice.
I mean, we can continue building hospitals, but we can also light the candle the other way and start looking at the structures that would allow us better health.
All right. As we continue to have this conversation, you know, when we mention stress, somebody's just asking me, kindly ask Daktari how stress is connected to heart disease.
I must first start by saying that stress is overrated when it comes to heart disease. It's important, yes, but don't blame stress because you say because of I'm stressed, I have high cholesterol. It doesn't work like that. Stress will promote high blood pressure, and it will promote an adverse hormonal profile. That will only add fuel to an already existing fire. Okay, it's not easy to light a fire with stress on its own. Acute intense stress, we know, is an issue. By that I mean a sudden event. You know, in fact, there's a condition called a broken heart condition. Broken heart states that's a sort of colloquial term for a condition where you see somebody die or collapse because they receive bad news. That's different. That's acute stress, and that's not that common. But what you call chronic stress, meaning ongoing, persistent stress levels, which may not even be easily realized, can promote certain situations such as diabetes and high blood pressure. But I wouldn't blame stress alone. I would be more inclined to look at other factors like physical inactivity. But yes, stress is an issue, and you can dissect that into depression and so on and so forth, anxiety states, but stress in general is an issue. All right.
Yeah. Another one is also on body weight, the connection between body weight and heart disease, and what's a healthy body weight?
Again, that's a tricky one. In fact, it's more body composition. You can be big, but relatively healthy because that's your genetic makeup, and you're mostly lean mass. And you can be big, and that's more what you call adipose tissue that's sitting around the abdomen that we think is an organ in itself that promotes bad health. Okay, so body weight, as it goes up, yes, is linked towards poor health, heart health, but not in all cases. So you have to look at each patient as they are. For example, there's this calculated thing, body mass index, where you take your height and your weight that's promoted. We don't use it as cardiologists now because we realize there's a disparity. If you take the Zulu tribes of South Africa and look at the way they look, and then go up to Northern Europe and look at the way they look, those are totally different people. They may have the same weight, but that distribution, the egg and the pear, for example, those are different. So we look at individuals, we look at the body fat distribution, but in general, the heavier you are, it's likely not good for you. But again, if you're heavy, fit, and you have a good composition, that's different from somebody who doesn't. So I wouldn't stick to that as an answer in itself. But if you're putting on weight from an already sort of lean, healthy state, that needs to be, you need to worry about that.
All right, and keep them coming as well on 22422 and at Citizen TV Kenya. The hashtag is Daybreak. We will be sampling your feedback as we continue to have this conversation. But the good news about all this is that, first of all, it's preventable, and we talked about how one can achieve that. Let's look at the other side of the coin in case you have been diagnosed with a heart disease or a heart condition. What's the way forward? Is it all doom and gloom?
No, it's not. And I must say that that's also important. I mean, we can talk about prevention and whatnot, but if we start by saying that half of the population has high blood pressure above a certain age, that means that half needs to be treated. So, do we have effective treatments? And yes, we do. What should they do? See their nearest clinician, start there, and let that clinician then decide, okay, good, I can handle this, let me refer you to the appropriate place. And that's where we come in as clinicians. We have the duty to direct people appropriately. Yeah.
All right. I'll keep on just asking you these questions as they come. There's one who's asking, ask about postpartum cardiomyopathy and how long a lady can get a child after that.
Yeah, and these are some of the heart conditions that I was mentioning that a bit esoteric, but they contribute to the pool of heart diseases. This is a condition, an unfortunate one, where a lady who gravid or pregnant develops heart failure, meaning the heart weakens, and it can be very, very weak. Actually, you can die from it quietly and you wouldn't know. Often manifesting around the time of delivery. Okay. Now, many of those women who develop this condition, just to digress a little bit, will present to us within a week or two post-delivery or in the time they're in the hospital. They'll think it's a normal swelling that, you know, people get when after post-delivery you're being plied with all sorts of porridge and whatnot. But in actual fact, this is the heart becoming weak and you're retaining water. Now, the heart tends to recover in a lot of patients once they deliver, of course aided by medication a lot of the time. And some patients will have almost what we call full recovery. But the reality is that there's a good recovery rate. Over 50% of those patients will recover quite well. But don't go get another pregnancy.
Oh.
Yeah.
Okay, so that's it?
Yeah. There are those who...
It's not recommended that you have another child?
It's not recommended. They haven't
but the heart can go back to normal?
It will go back. It will go back to, I would want to say near normal. It's never quite completely 100% normal. There are times we think it is, but there are ways now we can detect subtle abnormalities. We usually will find a subtle abnormality. For all practical purposes, you'll go back to normal life. Okay, in many of those patients. But a second pregnancy, a third pregnancy predisposes you to the same thing. And it can be worse the second time. Yes, there's some who get away with it. I mean, we've been forced. They come and tell you, no, I'm pregnant, so...
So what do we do?
Yeah, you take care of them.
But it's not recommended.
No.
If you can avoid.
No.
All right, so keep them coming. Of course, I'll be asking Daktari as you continue to share with us. We were talking about treatment.
Yeah.
And you were saying that treatment is possible.
Yes.
I just want you to walk us through what somebody should expect when they go to seek this treatment.
I mean, you've talked about high blood pressure. Let's pick something that I do quite a bit and perhaps worries me because it strikes people at very productive ages, and those are heart attacks. The strokes will strike people, yes, at productive ages, but they tend to come a little later. But what we are seeing now is a trend where we have patients who develop symptoms such as difficulty breathing and chest pain in particular, and chest pain of a kind that comes the center of the chest, coming on exertion or coming on suddenly and very severe. What has concerned me is that a lot of the patients who have had those symptoms are not aware that this could mean that you have a heart problem. Very often people will pass it off as, say, acid problems or some breathing problems. Some have even been put on treatment for pneumonia, TB and whatnot, with the clinicians forgetting that the heart is also there. So I think it's now time for people in the age groups of, say, 30 to 50, 60 to realize, much as you may think you're young and you think you're healthy and you've been leading life normally, if you suddenly get pain in your chest that you can't easily explain because maybe something hit you or you've got a bone that, you know, is a bit tender when you press, get help immediately. Okay? And I think that's one message about how to treat. If you get early treatment for an early recognized condition, the outcomes are better. Similarly, if you get headaches that are not easily explained and you have not checked your blood pressure, get it checked. Okay? Things like diabetes are very silent. You won't even know it's coming on. So routine checks for your blood sugar. Now, if you find that these are abnormal, all these things I'm saying, then where do you go? What do you do? Physicians are the people that will look after patients. But many patients have doctor friends or they have gynecologists, the ladies, and they have whoever. So they'll call them first. So I think we've been trying to educate our health workers to direct people appropriately. For example, sometimes just the other day, I saw a patient with developing a heart attack and they were given acid medication and told, go home, don't worry, you know, get into bed. How do you deal with that? It's very difficult. So we can only keep reminding doctors that we don't know everything as a person. Refer a patient, consult. So I think consulting and referring is very, very important. Now for the patient, walking into any hospital department, casualty department, and being checked is a start because most hospitals will have clinical awareness amongst their teams. For example, if you come to my hospital with chest pain, you'll be fast-tracked straight away into a possible heart attack, and they'll know what to do. If you go to, say, at the coast, maybe on an island, and you go to the health center, now they may not have that experience, but certainly you're at least seeing a health person who then should call and say, I've got this patient with chest pain or breathing difficulties, what should I do?
So they refer you or ask, consult?
On the phone.
Yeah.
It's very quick.
Okay.
And that way we're able to help you, because sometimes it's very difficult to get off, transport-wise, how do you get to a place and so on. And this whole issue of transport is very tricky. In certain parts of the world have developed systems of care where you even bypass, for an ambulance will bypass hospitals that they think will not be able to take care of, say, a stroke or a heart attack, to a hospital that's capable to cut that time. So the golden hour that we talk about in terms of acute heart attacks or heart attacks, or even strokes, now that we have a golden window opportunity for strokes, is something that people should take seriously and understand that time is of the essence. If I start feeling unwell, at midnight I don't just sit in the house. I call somebody and get out. Yeah.
Let's talk about this heart attack.
Yes.
Something that's becoming quite common. We hear about it on a regular basis.
Yes.
How big of a problem is it, and what usually happens, during that moment when somebody is having a heart attack? And even you can go ahead to tell us what are some of the things you're supposed to do if you're alone, or if somebody is within and notices that this person could be having a heart attack. How do we deal with it?
Yeah. First, I'll just start by defining it a little bit, because anytime somebody dies, they call that a heart attack, suddenly or in hospital. So a heart attack is quite a definable thing. It's when the heart blood vessel blocks and your heart malfunctions. That's different from, say, you're in a car accident and they try and resuscitate you and your heart stops. That's not a heart attack in most of the time. So it's a condition that involves the blood vessels of the heart. You can also get a clot from the leg, and I'm sure you've heard of all this, going to the heart or lungs, and then you die suddenly. That's not a heart attack. That's pulmonary embolism, or a clot that's gone up to the heart. Or you can die because you've ruptured a blood vessel, a major blood vessel. That's not a heart attack. So heart attack is fairly specific. But as far as people know, these are all emergencies. These are reasons why you should rush to hospital. So specifically, a heart attack is a situation that is treatable. Very treatable. You can reverse a heart attack if it is caught within the first 1 hour or 30 minutes. And it is possible. I've had patients come within 15 minutes when they live up the road and so on and so forth. But it can also kill you. And people can die suddenly. You've seen people talking and all of a sudden they go down, and that's a heart attack. So it has different manifestations. Now, your question, if I go back to it, let me understand it again.
Yeah, I just wanted to know, because it's sort of like we don't understand it. When it is happening, what usually happens, or some of the things that I can be able to look at you and say, this actually could be a heart attack. And then what do I do?
Okay, I'll probably address that specific issue, much as we're talking generally. And you did mention somebody's alone and what do they do and so on and so forth. I mean, in the last few days, I've had a couple of people who live alone and who are getting a heart attack. And one of them got out of the house really quick. The other one sat there till morning because they didn't want to call anybody, they didn't want to bother anybody, and so on and so forth. Both are okay, all right? But you could see the difference between the outcome of one person and the other. So getting to a medical facility quickly is important. You might ask me, how would I know that you're getting a heart attack? And I'll go back and say the majority of people will get chest pain, very severe chest pain. And even if they don't get chest pain, they'll get a discomfort, a bad one. Actually, it's been described like a shoebox in the chest, or somebody sitting on your chest. Those are some of the descriptions. And they sweat profusely. So if you are looking at somebody who's saying, I can't breathe, or I've got pain in my chest, and you see them sweating, think heart attack first. It's better and safer to think that and just get them in, rather than start wondering, maybe give them water and so on and so forth. And then you'll ask me, what can I give them, in the meantime? We promote aspirin, adult aspirin. But we find that also a bit tricky, because you don't know if the patient's bleeding or so on and so forth. But we still promote aspirin if you think that it's a heart attack. And there are helplines that have been set up that you can call and you'll be taken through, okay? But in short, chest pain, chest discomfort, sweating, shortness of breath, those are classic. If the pain is moving up to your neck or either arm, then that's suspicious. Now, there are a lot of people who come and say, my arm has been paining for the last 6 months and I think I'm getting a heart attack. No. Yeah, that's something else. Okay, just so that we don't have people cramming into casualties right now. So it has to be in context. You have to be unwell, you have to feel unwell, and it has to be coupled with breathing difficulties and feeling faint and weak. You can see somebody also collapse on the side and they tell you they're hurting in the chest, or you see them clutch the chest. That's a classic sign as well. Somebody who's probably having a heart attack. They could be having a clot as well, but that's still an emergency. Just get them to hospital. It's up to the hospital people to figure out. And in certain parts of the world, where I'll just give you one story. For example, I have one of my Wazee patients who was fine. I looked after him for 3 years. There was no problem. One time we went to Europe on a meeting not too long ago. And he was sitting in his hotel. He said, you know, the doctor told me I need to go to the gym whenever I travel and so on. So he went to the gym. And whilst, you know, on the cycle, he's I think 70 odd. He suddenly developed chest pain and fell on the side. Now, the ambulance was there in 12 minutes and he was in the hospital theater in about, say, 22 minutes. That's not easy. Yeah, that's unlikely to happen here.
Yeah, true.
But he survived beautifully, had his procedure and blocked the artery.
So the faster, the better.
Yes. Now, that should be our goal.
Take action immediately.
Immediately. So when we say immediately, we mean it.
Like
so
immediately,
yes. But our health response system is a bit tricky in the sense that we have not focused on it. Not that we can't achieve it. We just haven't focused on it. If you speak to ambulance services, they'll tell you we've got 10 ambulances stationed in different parts of the city or different parts. But you try call. Yeah, it'll take, if you're lucky, they'll come early. If not, it can take 2 hours just to get to an estate. So I think sorting that out is important. So if you're sitting in the house and you get unwell, if you can speed dial a number that you have pre-saved for help, that would be the ideal situation. Okay? If you think you're getting a heart attack from the talk I've just given you, take an aspirin and you come. What does aspirin do? It's not magic, but certainly I've seen a few patients in whom it has aborted the heart attack. A few.
All right.
Okay? And by the time you get to us, it makes it easier. What we do when you get to us, that's another long story. But in short, we can save you, we can get you back.
All right.
You just need to get to the hospital. To the hospital. Yes.
So does it just happen, or it is progressive?
It's progressive.
Because usually what we see is the few minutes that has happened and there's move. Like, does it just happen?
Yeah, no, I like the way you're putting it, because you could be just sitting with friends and suddenly one of them. And
so does it just happen from nowhere?
It can happen from nowhere. It can happen, it can manifest immediately. In fact, the word stroke comes from strike. It can just happen. Okay, you're sitting there. But a lot of the time, and many of my patients, they will say, I've had a discomfort, I felt something, I felt it the day before yesterday, I didn't think much of it, it came again for 50 minutes, I drank some water, I was sweating with that, and then I was fine. That's where it starts, okay, in a lot of people. In some patients, it will be that the last 1 year, whenever I'm going up to my flat on 3rd floor, 4th floor, when I get to the 2nd floor, I feel some discomfort. Or at home when I'm going up the stairs, or when I'm walking to work, whatever it is, they'll feel some discomfort. And that's why one of the benefits of being continuously active is the time that something changes, you'll know. If you're just sitting there, you're sitting duck, literally. It'll just hit you.
You will not know. So, you need to love yourself, know your body, understand it, and know when something is off.
And your neighbor. You know, there are times that somebody will actually be unwell, they look unwell, they don't want to bother anybody. You should be able to recognize in other people that that situation's not normal.
It's not normal.
Get checked.
All right. I want us to take a few, questions and comments from our viewers. 22422. That's where we invited you to just share with us your thoughts and questions. The hashtag is Daybreak, and this is what you're saying online. I'd like to ask about low blood pressure. A few times my blood pressure has been reported as low, and I'm usually told to drink lots of water. Is this something I should be concerned about? All right, low blood pressure. And then, can a person with a normal blood pressure have a heart attack? Do people with high cholesterol have high blood pressure? All right. We have one there. What is the enlargement of the heart? All right. We also have one. Ask Daktari about comorbidity of diabetes and hypertension in cardiovascular disease patients. What proportion in Kenya would he say has this? All right. We have morning, I'm 28, male. I've been feeling pain on and off on my left upper side of the chest for a period of 1 year. What could be the problem? All right, pain on the chest. There is one who's saying, hi, I have used blood pressure drugs for almost 2 years, on and off. I even quit alcohol for 1 year, but it didn't go low. No, now I'm doing exercise at home. I'm also hearing humming in my ears, but I'm not currently using blood pressure meds. My last readings were 147/90. Kindly assist, because I'm only 40, and these meds are not doing any good. Also, I barely sleep at night. All right, we have one there. I have a problem when I bend or sleep, so after waking up, my heart beats faster at times. It comes with headache and not seeing properly. Is it related to the heart? Okay, how do we push more screening of cardiovascular diseases at primary healthcare? Thank you. All right.
Okay.
Let's take that one, that last one. My blood pressure is always normal, but my pulse is sometimes over 100. What can I do to make my heart rate normal? A lot of questions. Thank you so much. We appreciate those who took time to ask these questions. And I'd like just to give Daktari a chance to respond. A lot of them revolve around blood pressure, and I just want you to sort of respond in general on the blood pressure, the low, the normal, the high, and also some of the concerns that a gentleman who says he has been on meds, it's not helping. He's only 40 and he's concerned.
I'm actually a little bit amused, although it's serious, at that was a long question. Yeah. And I think he's going to get a consultation right now, because he's given us most things I want to hear.
Medical history.
Yes. I mean, if his blood pressure is not settling, if your blood pressure is not settling, I think, and you've had physicians look at it, get to see a cardiologist. That's all I can say, because we are trained to, and perhaps we have experience now seeing a lot of people whose blood pressures have been difficult to manage. And it's an area that has been researched. We study a lot in this. So I think just get to see a cardiologist, because I have no idea what drugs are being taken and even what the patient reacts to. But taking time to see a cardiologist is important. If it's difficult to find one, because again, healthcare is not cheap in this country, anywhere in the world, then I think the Kenyatta National Hospital and KU and Moi Teaching, those have cardiologists as public health institutions, and I think in Othaya and so on. So they can get to see. And actually, even in the counties now, you'll get access to cardiologists. So find one, so that you get a proper consultation with regard to a difficult to manage high blood pressure, if it isn't difficult.
All right.
And that's an important message, so that you don't sit at home worrying about something and then perhaps not getting the right kind of attention. Yeah.
Remember, when it comes to heart diseases, the earlier, the better. That's what we are saying here. There was one who asked about low blood pressure as well.
Yeah. Now, low blood pressure in itself is not uncommon. And when we say low, what do we mean by low? I guess we have ranges that we say are normal. And there are many people who run slightly below that range, and they live to 100 years. But at the same time, if you've got a lowish blood pressure and you feel unwell, meaning dizzy, lightheaded, weak, you definitely need to be checked. And one of the things that we will check, of course, is a scan of the heart. And that's in a specialist center or in a specialist setting, where you get a doctor who has that experience, or an institution that has that experience to look at you. So I think they should see a cardiologist. Yes, all and right. Just get rid of that. Get one good checkup. If you're told you're fine, then you're fine.
All right. Yeah. There's also a question that was relating to the enlargement of the heart.
Yes, what is enlargement of the heart? That's when the heart becomes a little flabby, weakened, and enlarges. The heart has got, it's a very complex computer, so it can read that the heart muscle is not well nourished, maybe because the blood vessels are blocked and so on, so the heart enlarges to try and compensate for that. So heart enlargement is one of the manifestations of heart conditions, but can also be in itself a condition where you get a viral infection that attacks the heart muscle, which enlarges and becomes weak. So enlargement means that when we measure it, it dilates. But you can also have thickening of the heart muscle, which happens to people who have high blood pressure for a long time that's untreated. And again, we know how to measure the normal thickness. If that's increased, then it looks enlarged. Like if you get an X-ray, it'll look enlarged. So enlargement means just going beyond the parameters that we consider normal.
All right.
Yeah.
A lot was asked. I don't know whether I remember this question on comorbidity. Did you capture that?
Yeah, I think they were asking in cardiovascular disease patients, what is the rate of diabetes and hypertension? It's a different question depending on how you look. If you go to some of the counties and just check everybody adult there for diabetes, you'll find a rate of 1-2% perhaps. In certain communities, maybe even more. But if you go and sit and see all the heart attacks who came to us this last 3 months, how many have diabetes? You'll find a quarter of them have diabetes. So there's overrepresentation in certain populations, underrepresentation in others. If you go to Kilimani and say, I'm going to look at all those people and see who has diabetes, I really can't tell you, but probably you'll get between 2-3%. One of my colleagues went to Kibera and did the same thing, checked everybody. I can't remember the exact figure, but it was within those ranges in the adults. So I think that's where we play in terms of but there's something called prediabetes. And I think that's in fact, I consider that just as important as diabetes, because that doesn't just tell you your sugar's up, but also tells you your lifestyle is an issue, or your diet is an issue, or you seem to be genetically predisposed to these conditions. They walk together, the high blood pressure, diabetes, high cholesterol, and obesity. They're good friends. And when you find one, you find the others.
There is a chance of another also being.
Yeah, so when you pick one of these, look for the others.
All right. Yeah. We've come to not actually the end, but let's just leave it at that for today, because it's a conversation that, goes on. As we are marking the World Heart Day on Friday, somebody who's been listening to Dr. Kariuki this morning, what would be your clarion call?
I think it's just a healthy lifestyle. Just start doing more physically. And by the way, it doesn't matter the age. We've got our people in their 80s and 70s and 90s lifting weights, small ones.
True.
Walking, exercising. Start early. If you walk into any primary school, the obesity levels are scary. Start there. Formal physical education is not compulsory anymore in the high schools. We need to think about that. Yeah. So I think physical inactivity is my message. Healthy diet is a bit trickier, but that's very, very important. Yeah.
All right. Get moving, do something, get out there, walk. Just be active. It will go a long way in helping you live a healthier lifestyle. They recommend daily 30 minutes, 1 hour if you can, moderate intensity exercise, depending on what you can, but just do something. Start somewhere. It could go a long way. Plus, watch what you eat as well. Love your heart, love yourself. My name is Safira Chengoma. Thank you so much for creating time for us this morning on the health segment. We do this every week on Wednesday. Do join us yet for another segment next week. Same topics, just to help you live a healthier lifestyle. For now, have a lovely day ahead.
Thank you.
That was good.
Oh, I enjoyed it. I'm sure.